let's remind ourselves also that the red cell lives an average of 120 days, which as we now all know is 4 months. 120 divided by 30, 4.
My name's Tim Evans. I'm an internist endocrinologist here at the University of Washington, and I see patients here as well in our clinics. But most of my time, 90% of my job is spent here at MEDEX, where mostly what I do is teach our students. I give 250 to 300 hours of lecture a year.
But you said that sometimes part of the interaction in the classroom is a little bit of goofiness.
Yeah, quite a bit of goofiness. Well, I'll spend 3 hours up there drawing my terrible drawings on the on the blackboard, and I'm sort of famous for those. Yeah, it's stand-up comedy, it's stand-up theater, it's improvisation. There, of course, is material to cover, but I say it a little differently each time. It's not a script that you can read for 3 hours. At least you shouldn't.
Which is how much iron could be carried by the woodchuck of a woodcut. How much iron could be carried if the
people stay awake and they stay involved. If it is a little bit goofy, and I've got my series of jokes. I tell the same jokes year after year.
And it turns out that among the great tasty things that come out of cigarette smoke, there are also some bad things, which is surprising because normally you take dead leaves and roll them up in paper, stick it in your mouth, set it on fire and suck on it. What could be better than that?
And I have all these sort of Evansisms that appear in each lecture. Sometimes I'll say to them, we're not leaving this room until everybody gets this.
Say, holy cow, you have this severe anemia.
Holy cow. Holy cow, I know what that is. Another Evansism is, if you don't think that's the slickest thing you ever saw, then you're in the wrong place. And I hope that they'll feel that way, and they'll continue to feel that way through their whole careers. I think that PowerPoint is deadly. Part of what's good about not using PowerPoint is you can actually look people in the eye and see whether they're engaged.
So you actually look at, you look to see if there's sort of a deer in headlights or confusion, and even if they haven't asked a question, you'll come back and
yes.
run
Yeah,
through it
if I
again.
see the look that says they're not getting it, then I'll say it a different way.
You remember what kind of organisms the spleen is important for fighting? Somebody to say encapsulated organisms? Is that what everybody kind of said at once? Encapsulated organisms.
So he came in a couple months ago and showed us very similar to what we saw today. He'll put the emphasis on different points, but seeing it multiple times is helping me get it. For the first time I understood the clotting factors.
And that's finally the final clot that forms to plug up the blood vessel.
I've heard that once I hear the same thing 7 times, hopefully it'll stick. And it hasn't quite yet. They're complicated lectures. But they're really inspiring and informative, and he's very entertaining as well.
And we would say, holy cow, diabetes is great for the kidneys. They filter like mad, and we should all have diabetes to get that. The problem is that
Inevitably, you're going to get a question you don't know the answer to.
Well, and I tell them that, and I often will make my best guess.
Do you tell them that you've made a guess?
Yeah.
Why is central adiposity a risk factor for type 2 diabetes?
Yeah, that's a great question, and the answer is we don't really know. It is. But, well, I tell them here's how I would think through that. I show them my approach to getting as far along as I can on the answer to that question. It's just that central adiposity will increase insulin resistance, and if you've got the genes for diabetes, then ultimately you won't be able to respond to that normally. Until I realize I have run out of my own personal fund of knowledge about it. But then I've defined it a little bit further. And I know exactly what it is I'm going to go and try to look up. So I think it's useful to not know the answer, because they can see the process of how you try to think through it. Use what you do know and how to think through that. Well, our students, year after year after year, are really terrific. They're smart, they're hardworking, they're here for a reason, they know why they're here. They have a great deal of respect for them. They've sacrificed a lot. I mean, most of them have homes and families and mortgages. They've all been working in jobs, so they've had income. So for 2.5 years, they have to get by on no income, often leaving their families at home. Many of them move here and their families stay where they were. But regardless, they're really making some very serious sacrifices. You have to honor that, and I do. And I recognize what they're doing, and so I try to give back to them. People can spot it in a second if you're all full of yourself. They can also spot it if they feel like you genuinely care about them and you're doing your best to make this material clear for them.
I love Dr. Evans' lectures because it goes right down to the cellular level, so you know exactly what's going on and you can relate it to all of your previous experience and tie it all in together with how it actually works and what you can do about it in the future. It's fantastic.
You don't have to know everything, and the real truth is you can't know everything. What you need to know as a clinician is what you know and what you don't know. What's most important for a clinician is actually to care about the patient enough to know everything about them. And the truth of the matter is that if you do that, if you really are as complete as you can be, then usually the answer will lie right there in your lap. They'll tell you what the problem is. But you have to care enough about them to want to do that. When it comes to teaching, you have to care about the students enough to do that. And that's what it takes to do this.
What's your favorite part of the year of the program?
Graduation day. It is so much fun to have seen these students go through these 2.5 years and the advances they've made and the strides they've made. And they don't realize yet how much they know. You don't know it until you get out there. They would know it if they saw that they were teaching the brand new students. They'd say, well, holy cow, I know what that is, of course, and you can't take nearly as much credit as a parent can. But the same joy that a parent feels when they see their kid finally get to the point where they are experts themselves. And they can fly off and they can do things that you never could do. And there isn't anything better than that. And there isn't anything better than in this either than seeing these students take flight. I love that day. Part of setting them up to be lifelong learners, it's also true that by the time they graduate, part of what we tell them now will be wrong. And the trick is finding out if we knew which part it was, we wouldn't tell them that part, but we don't know. And so over their lifetime, things will change. It's a lot of fun learning this stuff, and the whole process will continue not just through their MEDEX training, but for their lives. Because it is fun. And in the long run, there isn't any reason to do anything unless it's fun. In the short run, you have to do things like mowing the lawn and mopping and taking out the garbage and stuff. But over a lifetime, then the things that you do ought to be fun. It should be enjoyable and satisfying and engaging, something you look forward to. And I hope that this will be the beginning of a lifetime of enjoying learning medicine for them.
Okay, well, thanks a lot. This is it for me for this quarter. So,
And cut.
Even a little bit.
Action.
Holy cow.